Welcome back to Beyond Well. I'm with Professor Gail Hornstein, Professor of Psychology at Mount Holyoke College in Massachusetts, and also Director of the Hearing Voice Project. Hearing Voice peer support groups offer a powerful alternative to mainstream psychiatric approaches for understanding and coping with states that are typically diagnosed as mental illness. Good morning, Gail. Thanks for joining us.
It's a pleasure to join you, Sheila, and to talk about the really exciting research that our Hearing Voices project has been able to do. This work is the first project to be conducted in the U.S. It's the most in-depth study of Hearing Voices peer support groups, and it's the very first study in the world to be designed and conducted by a team that includes researchers, voice hearers, peer advocates, and clinicians who are working together to try to understand Hearing Voices groups. This project is a collaboration between the Western Mass Recovery Learning Community, the RLC in Massachusetts, and Mount Holyoke College, and is funded by the Foundation for Excellence in Mental Health Care.
Well, it's incredibly cool that you managed to get 113 members from across the United States who are all so focused on this particular question. So what were you trying to understand, Gail? What was the research looking at?
The research has been looking at how Hearing Voices peer support groups work. These are groups that have been spreading around the world over the past 25 years. The United States is very late in the process to adopt these groups, but these groups are now spreading more and more across the United States, partly thanks to the training efforts of my colleagues at the Western Mass Recovery Learning Community, who have trained many facilitators of these groups. But one of the problems is that mental health professionals, especially in the U.S., are unfamiliar with these groups and aren't convinced that there is an evidence base to support this approach. So we wanted to conduct the kind of research that would provide this evidence base. But it's very complicated to study Hearing Voices groups for a number of reasons. And this is one of the reasons why there hasn't been much research. One of the reasons is that people don't attend these groups for a fixed period of time. So you can't, for example, with, say, a cognitive behavioral therapy group, you can assess someone before they start the group, then they can go to 10 sessions of the group, and then you can assess them again at the end. But people often go to Hearing Voices groups for indefinite periods of time, or they go for a while and then they come back. They also come for many, many different reasons, and they have many different types of experiences. We call them Hearing Voices groups, but not everyone who goes to these groups has the specific experience of hearing voices. They often have other kinds of anomalous experiences for which they experience some distress. And also, let me emphasize that one of the big problems in doing research of this kind is that, if you're evaluating how a drug works, you can randomly assign some people to the condition where they get a drug and some people to a control group where they don't get one. But Hearing Voices groups depend on important relationships among people in the group and the voluntary commitment of people to go to these groups. You can't simply say to someone, you're going to a Hearing Voices group, and to someone else, no, you're not.
Yeah, that makes so much sense.
It's contrary to the whole philosophy that underlies them. What we wanted to understand really is how exactly these groups work. More and more people are flocking to them, and more people want to be trained as facilitators, but really no one has been able to identify before in the few studies that have been done how exactly it is that these groups work. So that was the focus of our study.
So what did you find out, Gail?
Well, first of all, we found out that people who participate in Hearing Voices groups, who often have been in many other types of clinical groups or peer support groups or AA or other kinds of 12-step groups, find these groups distinctive and different in many respects. And let me just identify some of the ways in which people, members of these groups, who, as you said, we recruited from all over the country. They've been in groups in many different locations in the U.S. The groups, these Hearing Voices groups, offer a context where people can talk about whatever experiences they are having and other people respond in a non-judgmental way. The whole focus is not on pathologizing people's experience or trying to just get rid of it, as often has been the case with a medication approach, but rather to understand it. So people are asked questions about, what are these voices saying to you and why do you think they're there? And there's an important role for facilitators in these groups, but facilitators are not therapists. They're trained to be facilitators, but they don't run things. There's a sense of mutual responsibility among people in the group, a great sense of curiosity that helps people to articulate what their actual experience is like, a sense of belonging and connection among people in the group. And one of the really important aspects of Hearing Voices groups is that people have the opportunity to help other people as well as to be helped themselves, even in the same meeting. And so that is very important because it strengthens people's sense of efficacy and like they have something to offer, even if they themselves need some support and some assistance.
That's so interesting, Gail, because I have heard from so many people who were in psychiatric groups that it so often wasn't the facilitator or the doctor who gave them an insight, but a fellow patient, just in terms of a coping mechanism or at least the assurance that they were not in this horrible experience alone or, something that had a lot more resonance because it was from a person with lived experience rather than somebody kind of telling them how it is.
That's exactly right. And one of the things that is a hallmark of the Hearing Voices approach is valuing expertise by experience. And it's not only that people provide support and saying, I was there, I know what that's like. It's just what you're saying, Sheila. It's that there are really valuable strategies that can be offered to one another to really enable fundamental change to occur. And we found in our study, going back to our findings, 79% of our participants reported experiencing helpful changes either in their voices, in their social relationships, in how they understood their voices as a result of being in the group. So even people who continued to hear voices, those voices became less bullying or less frightening. They had more empathy. They could say, for example, what are you trying to tell me? Is there something important I need to learn from this situation? And people developed, this is a very important aspect, much deeper and important connections, not only with people in the group, but with social relationships outside the group.
Do you have anything to compare this with, Gail, in terms of the people who have heard voices but perhaps have used only psychiatric medications, people who have been on psychiatric lockdown? Does this 79% improve rate compare favorably to what the outcome is for other people?
Absolutely. One of the biggest problems with medication is that even when it helps people, which it does for some percentage of patients, it often does not help them over an extended period of time, and it doesn't enable people to develop coping strategies of their own. If they develop a toxic side effect reaction to the medication, they haven't learned anything about what else to do.
Oh, wow, interesting.
And, there are many people who go to Hearing Voices groups who continue to take medication. This is not an exclusive approach and no other kind of intervention is welcome, but what's so important about this approach is that people learn a variety of ways to cope when they have distress.
Right.
Some people hear voices that don't cause distress, and many people actually, as a consequence of being in these groups, have more of a differentiation among their voices. So some voices may continue in a supportive way.
Wow.
And the voices that were very distressing to them may be the ones that disappear.
Were there any other findings that were completely unexpected to you, Gal?
Well, I wouldn't say completely unexpected, but what our project is working on right now is developing a model a three-phase model that explains exactly what are the processes that occur in these groups that enable this kind of transformation to happen. Because it's not as if participation in a peer support group of this kind, like any peer support group, it's not it doesn't have an instantaneous effect. There's a phased process. And our project is, for the first time, trying to identify what are the phases that people go through and how, over time, does the group enable them to make really substantive changes in their lives. I mean, this is, to me, the most exciting part of this approach, as someone who is a professor of psychology, is to see how radically transformed people's lives can be. I mean, I have known many people who say, my doctor said to me, as long as you can, get up and make yourself breakfast, then you're doing great on the medication. But that wasn't enough. That wasn't a life. That wasn't, the way people want to be able to thrive in their lives. And that is what is so exciting, is that our project is really the most in-depth study that has yet to be conducted on this approach. As I said, it's the first in the U.S., and one of the things that we're hoping is that we'll be able to get additional funding that would enable us to do further analyses of our data that we've collected so far, and to be able to do important comparisons, like, is there a difference between people who are new to a group versus experienced members, or people who participate in online groups versus in-person groups, and so on, to be able to really tease out the specific ways that this approach is so helpful to people.
One of the incredible findings that I've heard just tangentially from other doctors is that when they use the Hearing Voices method, when they engage, they actually have much higher degrees of satisfaction with their practices. They feel like they're getting much a better connection with their patients, and have a just way different view of what it means to be a doctor, a healer.
I think that is so important, and that is one of the areas that we are, in our project, reaching out to provide forms of support and also exchange among mental health professionals, to be able to think about ways to be as helpful as possible to people who come to them in distress. Because I'll say that, again, as a psychology professor, one of the things I've learned that's most inspiring and kind of humbling about the Hearing Voices approach is really this focus on expertise by experience. That because there is in these groups a sense of mutual respect, that other people, regardless of their path in life, whether they've been in a mental hospital or they've been in a prison or they've experienced distress for a long time, they still have important expertise that they can share with one another. And if we're curious enough and interested in what is it that's happening when people hear voices? Why are these voices coming? What are they trying to say to them? Why is this happening? That's the kind of learning that can happen in these groups. And I think, I am not myself a clinician, but I think that for clinicians, this is a very, very exciting approach, because it empowers people who've been patients, and it enables clinicians to learn more about the inner experience of the people that are coming to them for help.
Yeah, that's so cool. So what are the next steps for your project?
Well, we're hoping, as I say, to get additional funding so that we will be able to do further analyses of our data and to publish a series of articles. What is important in creating an evidence base for an approach is to have a body of research that's published. And so that's what we're focusing on, and we're trying to analyze in greater with greater detail differences between different people's experiences. We want to talk about different pathways through the Hearing Voices group approach. So, there are people who, for example, have experienced a specific trauma in their lives. How does the group help them cope with the trauma? There are other people that have just highly unusual experiences that they're not able to talk about with, people in their family or other people they know. How does the group help to support them and enable them to make connections with others despite their anomalous experiences. There are people who have heard voices all their lives. There are people who just began hearing voices in response to a particular situation. So we really want to tease out how does the group function for these different categories of people.
It occurs to me, just in the way that you've described the functioning of the group, that this type of group interaction, this supportive, open, honest exchange of people and their experiences might also be helpful in coping with the global pandemic and the isolation that we're all about to face because of it.
I absolutely agree with that, and I feel strongly, as someone who has been privileged to participate in many Hearing Voices groups over a 15-year period, and to work with my colleagues at the Western Mass RLC on their own efforts to start peer support groups and train people to facilitate them. I have learned a huge amount that is helpful to me in my own personal life, and which I share often with colleagues and friends and members in my family. For example, the kind of attentive listening to one another to really understand what is the basis of people's anxiety. There are some kinds of anxiety that are a helpful stimulus to do things, and there are other kinds of anxiety that become crippling or incapacitating. One of the things that we focus on in Hearing Voices groups is what can you control and what can't you control? So, for example, none of us can decide what government policy should be.
That's right.
So focusing on that in minute detail is not going to help us. Focusing on things that you can control, for example, limiting the amount of TV, social media consumption. Yes, it's important to remain well informed, but not every second. Not every minute. If you clutter your mind with incoming information that has, varying degrees of credibility, you'll become anxious all the time.
That's right.
But also, another very important thing I've learned is that just because people aren't together physically in the same room doesn't mean they have to be socially isolated. There are many different ways, fortunately, these days that we have to connect with one another. Telephone, text, email, right. FaceTime, Skype, online groups.
Yeah.
Even writing letters. Think about how wonderful it would be to receive a personal letter from someone in your mailbox that you haven't heard from for a while.
No kidding. I would also just like anybody who is, has the kind of privilege to have spare time on their hands right now to think about how do you support a person who has the kind of isolation that we know that people are up against. Gail, it's such a delight to talk with you and catch up on where you are with the Hearing Voices Network, and I'm so thrilled about you getting this research completed. It's really cool.
Thank you so much, Sheila. It's a pleasure to talk about it, and it's a very, very inspiring approach that I'm delighted for people to learn more about.
And if you want to learn more or support the work that Gail is doing, you can click here at the Foundation for Excellence in Mental Health Care. Thanks again, Gail.